And still staying with health. Prescription addiction, this time, prescription drug abuse in New York is climbing at an alarming rate, and it's ruining people's lives, devastating families, increasing healthcare costs, and raising insurance rates. That's what the New York Alliance Against Insurance Fraud says. Abuse of painkillers like oxycodone have become more prevalent than cocaine and heroin combined, according to the Center for Disease Control and Prevention, the CDC. New York prescriptions for oxy alone have risen 82%. That is what New York State Attorney General Eric Schneiderman has been saying. So our guest, Jack Houston, chairman of the New York Alliance Against Insurance Fraud, said this about the increasing use of prescription drugs, quote, "Often parents and friends are unaware of a growing prescription addiction until it is too late. So early prevention is key," unquote. And Jack Houston joins us now. Good morning, Jack. Thank you for joining us.
Good morning, Esther.
How are you? I'm very good. I've been resisting the urge all morning to say, Houston, we clearly have a problem. But I gave it in the end. You walked into that one, right?
You got that right, especially with this heat wave going on.
I know, for real. And so, wow, 82% increase in prescriptions for oxycodone alone. Is this specific to this particular painkiller? We're talking about prescription drug abuse across the board. Just lay it out for us.
Actually, what we're looking at is prescription drug abuse across the board. And currently, right now, what we feel that we're in the midst of a prescription addiction epidemic. Prescription overdose right now is the second highest cause of accidental death in the nation, right after car crashes. Abuse of painkillers like oxycodone has become more prevalent than cocaine and heroin combined. As you mentioned previously, the Center for Disease Control tells us that teen deaths from overdose have risen 90% in recent years. So it's a big deal. And it's raising all of our insurance premiums, devastating families and destroying lives. And just recently here in the New York area, we had I think within the last year, we had 2 tragic shootings involving robberies at pharmacies caused and driven by this oxycontin. And in one, there were multiple people murdered, and in another one, there was a law enforcement officer, off-duty law enforcement officer who was murdered.
So what is oxycodone? What's it normally used for, and how has it become kind of the prescription drug abuse of choice? How has that happened?
Well, from what I know, it's a synthetic opiate, and it's actually used as a painkiller. So there's a lot of various reasons that people use it, one of which is to get high. Some people use it for pain that they've been prescribed to, and then through abuse become addicted to it.
Now, apparently, there's new legislation that was put into place by New York State last week that's supposed to put the brakes on people who, quote, doctor shop, which is the practice of getting multiple prescriptions from different physicians. Talk a bit about some of the other things that need to go into place in order to bring these numbers down.
Well, what I will touch on with the Internet System for Tracking Overprescribing Act, or ISTOP, right, which was passed unanimously in both the Senate and the state, aims to prevent prescription drug abuse by creating a real-time electronic database that doctors and pharmacists must refer to before filling out prescriptions for patients. New York State will be the first state to mandate that physicians consult a database of patients' prescription history before prescribing certain controlled substance. What that's actually going to end is that will end this doctor shopping that takes place, where individuals will go from one doctor to another doctor to another doctor, complaining of the same ailments to try to get multiple prescriptions for this drug. One study actually puts the potential overall cost of painkiller abuse at more than $70 billion a year. Pill addicts who shop around for doctors to score prescriptions cost insurers about $10,000 to $15,000 apiece. The toll in lost productivity is roughly about $42 billion, and the criminal justice bill is about $8.2 billion. So eventually, it all adds up. ISTOP, however, will make New York the first state to mandate that physicians consult a database before prescribing, and it'll make it the second state to require real-time reporting by pharmacists when filling various prescriptions. So, ISTOP will assist in ending forged and stolen prescriptions by addicts and drug dealers.
Is it enough?
Well, I don't think it's ever enough. I think what you really need to do is like what we do here at the New York Alliance Against Insurance Fraud, and that is trying to educate people so that they know it to stop it, and making people aware of the fact that insurance fraud, such as prescription drug abuse, is something that actually we all pay for. It's a crime that we all pay for. And
because you say that consumers pay for the prescription fraud because they get higher insurance premiums, and obviously the prescription addicts are very sadly paying with their lives and certainly the devastation of their families.
Yes, in essence, if someone goes to the doctor and fakes symptoms to get a prescription, it's fraud. The insurance company pays for that medicine. If the individual has health care and drugs, we all pay for addiction in the form of higher premiums. If an addict is on Medicare or Medicaid, our tax dollars go to fuel this illicit use. So prescription dealers will fake the symptoms of attention deficit disorder in order to get their hands on medication that they don't need, whether it's painkillers or Adderall or Ritalin. They'll then turn around and sell the pills to their peers, not realizing that they're getting hooked on a cycle of fraud and addiction. Most prescription medication that is sold on the streets in one way or another comes from a doctor's prescription and is paid for by insurance. So we are all paying for this abuse in the way of higher premiums, as I mentioned previously. In New York alone, there's been an 82% increase in oxycodone prescriptions than in previous years. And there's a wide use for the pills. One of the things that we've heard about is too many teenagers are taking Adderall and Ritalin to create a focus boost when studying for exams, and too readily share them with friends. And adults take painkillers to escape reality or get high, or just because they're addicted to painkillers from the first part. There have been several high-profile people who have been addicted to painkillers legitimately and have had problems. That's Brett Favre, Anna Nicole Smith, and Heath Ledger, to name a few.
And so, as we close, is there a site that folks can go to look for ways to prevent prescription addiction? I know you have information around that. Can you share that?
Yes, absolutely. Yes. What there is the New York Alliance Against Insurance Fraud has a website, and that's fraudny.com. And once again, that's fraud, FRAUD, ny.com. And if people go there, they'll see tips that the Alliance has out on ways to spot prescription drug addiction and other useful information for people to become more knowledgeable about all forms of insurance fraud. And that, again, is the crime that we pay for. Currently, right now, we have 8 steps on that website that people can take a look to see about prescription drugs.
Jack Houston, Chairman of the New York Alliance Against Insurance Fraud. Thank you so much.